Hi everyone, welcome back to another topic, and today's topic is on signs and symptoms of pelvic inflammatory disease. First, let's understand what is pelvic inflammatory disease and what causes it. So, pelvic inflammatory disease or PID is a condition involving inflammation of the upper portions of the genital tract, including the endometrium, fallopian tubes, ovaries. And so this inflammation can be spread into pelvic peritoneum, which is the area surrounding the uterus and other reproductive structures. So let's understand what causes pelvic inflammatory disease. This PID is caused by bacterial infection, and this bacteria which causes the pelvic inflammatory disease include chlamydia and gonorrhea. These two are going to be very significant causes for pelvic inflammatory disease, and both of these are sexually transmitted infections. And we can also see some other bacteria that can cause pelvic inflammatory disease, and these bacteria which causes the pelvic inflammatory disease are the ones that are going to cause urinary tract infections. So the bacteria like E. coli among some other bacteria can cause urinary tract infections and can cause pelvic inflammatory disease. So the risk factors for this condition are: one of them is going to be a patient less than 30 years of age, and also the patients who are at the risk for getting sexually transmitted diseases like chlamydia and gonorrhea. Another risk factor for pelvic inflammatory disease is the time immediately after getting an intrauterine device inserted. So, an IUD insertion right afterwards, there is a certain period of time. As the intrauterine device is inserted, there is some risk that there can be some infection and other gynecological procedures. So, few of the important points we should note are: this PID is of two types: acute pelvic inflammatory disease and chronic pelvic inflammatory disease. So, two-thirds of the patients affected with pelvic inflammatory disease are asymptomatic. So, let's see what are the signs and symptoms of this PID. If the patient does have signs and symptoms, they are going to have abdominal pain, and this abdominal pain is going to affect the lower portion of abdomen, that is the lower quadrants are going to be affected with pain, and the most common is the right quadrant is going to be commonly affected with pain, that is right lower quadrant is commonly affected in PID cases. So pelvic pain is another symptom that may be intermediate but may become more constant in chronic pelvic inflammatory disease, and this pelvic pain will be on palpitation, it's tender to palpitation, and it's going to be tender in the adnexal area. So this adnexal area is the area where the uterus is located. So because the uterus and the surrounding structures of this uterus are inflamed in this PID, it's going to cause pain and tenderness when someone pushes on that area. Now a particular clinical finding that is seen is with pelvic pain, and that's called cervical motion tenderness. So this is not going to be someone that patient is aware of on its own. It's going to be something that occurs when the clinician is examining the patient, that is during the speculum examination, and they actually push on that cervix. That motion or that push on that cervix causes pain. So these particular signs and symptoms are very important, because in order to actually make an official diagnosis of pelvic inflammatory disease, lower abdominal pain must be present, and either one of the following signs and symptoms should be present. So coming to other important signs and symptoms of pelvic inflammatory disease include fever. This is actually going to be a common sign of PID. So as the inflammatory effects going on within the pelvis of the patient, this is going to cause a high rise in temperature. So the patient may have high fever. Now vaginal discharge is also another finding in pelvic inflammatory disease. So this can be either vaginal or on speculum examination. There may be some discharge from the vagina, and this may be noticeable to patient or only on the examination by clinician. and the discharge is going to be mucopurulent in nature, which means it's essentially mucus and pus. So it's going to have some smell as well. And we can also see fatigue occurring in these patients, so feeling very tired or having low energy, and this is common in pelvic inflammatory disease, and this is essentially due to inflammatory state. And now they can be nausea and vomiting, although this may be an uncommon finding in PID cases. They can also be bleeding in pelvic inflammatory disease. This is going to be abnormal uterine bleeding. This can be noted as spotting, for instance. And basically, again, it's bleeding when not supposed to bleed. So, if a patient is not having his menstrual period and they are having bleeding, that would be considered abnormal uterine bleeding or spotting. Patients with PID may also experience dysuria, that is burning sensation when urinating, or painful sensation during urinating. This is an uncommon finding in PID patients, but may be present if preceding or co-occurring urinary tract infection. Dyspareunia is also another finding in PID cases. This dyspareunia is pain while having sexual intercourse. This is more likely to occur in chronic pelvic inflammatory disease. So, another finding is infertility is a significant complication of pelvic inflammatory disease. Infertility, that is difficulty in getting pregnant, can occur in patients who have symptoms of PID and in those who are asymptomatic or who do not have any symptoms due to scarring of genital tract structures. So let's understand what is the homeopathic approach in pelvic inflammatory disease conditions. There is an excellent scope of treating many gynecological conditions including pelvic inflammatory disease in homeopathic system of medicine. Homeopathic medicines boost the body's natural defense mechanism to fight with the infectious agents and clear up the infection to treat PID naturally. The first drug of choice is sepia. Sepia is an excellent homeopathic medicine for treating PID with marked pain in lower abdomen or pelvic area. In this, vaginal discharge of yellowish or greenish may also arise that may be offensive. Next is Muxol. Muxol is a natural medicine for PID with excessive vaginal discharge. The symptoms that indicate the need of Muxol include acrid, excoriating, and itchy discharges that cause a burning sensation in the vagina. The third drug is phosphorus. Phosphorus is a beneficial homeopathic medicine for treating PID cases. The uterine bleeding tends to be profuse. Weakness usually follows the menstrual bleeding. Leukorrhea of white or watery mucus may be present. Sabina is a well indicated homeopathic medicine for pelvic inflammatory disease with heavy periods. The periods are profuse and gushing in nature. Motion tends to worsen the blood flow. This remedy is also recommended for inflammation of uterus and ovaries that may occur following childbirth or an abortion. So that's all for today. I hope you like my video, and if so, please do not forget to like and share my video with your family and friends so that it may help others who are suffering with pelvic inflammatory disease. And please do not forget to subscribe to my channel and hit the bell icon and support me. Thank you so much for watching. See you in the next video.